Hi, this is Dr. Homer Lim, and you're listening to your Holistic Health Podcast. So this afternoon, we're going to be talking about ozone therapy. Okay, so first, I guess we have to start with what is ozone. No? So ozone is actually a molecule composed of three oxygen atoms. No? So you have three oxygen atoms, which makes it in an ozone as compared to the ozone that we're breathing now. It's composed of two atoms of oxygen. No? So when we say ozone therapy, what we're doing is we're actually introducing ozone gas. No? Ozone gas into the blood. It could be in the blood. It could be through the ears, through the rectum. Some people do vaginal insufflation, they call it. Some do rectal insufflation. So before we go to that part, so we have to discuss first what is ozone, what's good about ozone. Actually, ozone gas is naturally occurring gas, no? So usually we find it more concentrated in areas, in places there is high amounts of electrical or static electricity, no? Especially before or during a thunderstorm, no? The electrical discharge ng lightning, no, produces the ozone gas, no? So that's why before a rain or during rain, you smell something, parang metallic, no? Or something parang fishy, something like that. So that is what you smell, ozone, no? So there are also places wherein there are high amounts of ozone compared to ordinary, non-special place without ozone. So usually places like mga waterfalls, they usually have high levels of ozone generated, no? Now, what's the benefit of ozone, no? So ozone, actually, people started using ozone was actually in the late 1800s, no? So they actually use ozone to sanitize or clean the water, no? During the late 1800s, there was no such thing as chlorine or fluorine to clean the water. So actually in Germany, they use ozone. So back as early as the late 1800s, they were already using ozone, no? So that's to clean the water, no? To avoid people getting sick, because of course, if your water supply is not clean, then you can have what we call food poisoning, or what we call bacterial or amoebic diarrhea, no? So that's how ozone started. It was used to sterilize, no? Later on, they found out that ozone gas, somebody experimented using ozone gas in body fluids, no? Specifically sa blood. So what they do with sa blood, ozonizing blood, is they take the blood out, ozonate the blood, parang you're introducing ozone and then reintroducing it back to the person, no? So this was initially started by a Dr. Farr, no? Dr. Farr, F-A-R-R. So he was one of the pioneers on using ozone therapy, no? So what we call oxidative therapy. So they found out that if you do ozone, what we call ozone treatments, no? It can kill certain bacteria, certain viruses, not really parasites, no? Or fungus. Maybe some fungus, but it's not actually directly killing the fungus, because fungus, it's not really in the blood. It's more of in certain areas of the body, But for bacterial, for viral, they found that it's really very effective in killing the offending organism, whether it's a virus or bacteria, no? So they develop, as time goes on, they develop ozone therapies, no? So in fact, early 70s and 90s, no, how were they giving ozone? Literally in a bottle of ozone air, no? So they were actually giving, this is a true story, they were giving ozone gas, no, into the blood. So air. So they had to be careful to avoid, patient, of course, pag masyadong maraming ozone or air, no, doesn't have to be ozone, air, no, tawag nating air embolism, you can die. So then somebody thought of, maybe we can use water or yung IV fluid. So then they started ozonizing IV fluid, and they found out to be, maybe, it could be effective. Yeah, it seems to be effective. So somebody thought, why don't we just get the blood and try to ozonate that? So that's what the next steps were. Getting the blood, drawing the blood out into a bottle. It's like, you're donating blood, no? So you donate, they get the blood, ozonate it. So when you're ozonating that blood in the bottle, you're actually killing some forms of bacteria or viruses, no? and that can somehow, when it's done, the blood is after it being ozonated, it's returned back to them. So a lot of patients felt good with this therapy. So this is what we call the autohemotherapy. Auto meaning self, no? Hemotherapy, blood therapy. So it was what they call major autohemotherapy. Yung minor naman, they just get mga 10 ml of blood, ozonate the blood, and then reintroduce it back by injecting into the muscles, no? Usually for muscle pains yan, no? So you have major autohemotherapy, you have minor autohemotherapy. You can also have ozonation of IV, saline, no? So they ozonate saline IV, then they are injected. So some also do ozone injection, so direct ozone injection into certain joints or muscle, to decrease pain, increase mobility ng joint, no? So they also do that. So some also do what we call, as I was earlier saying, ear insufflation, especially those who cannot, they're afraid of doing IV, right? Ayaw nila matusok. So they do ear insufflation. So it can penetrate kasi through the ear, very thin membrane, yung eardrum natin, no? So ozone gas can somehow penetrate that and actually goes into the circulation. But of course, it's not as, strong, no? Or as effective as using IV forms of ozone therapy. But you can do that. Some people do what we call vaginal insufflation, Others do what we call the rectal, no? But I won't suggest you to be inhaling. Some people kasi do nasal ozone. We don't really recommend that because it can destroy your smell receptors. Yung sense of smell mo pwedeng mawala. Baka sabihin may COVID ka. So, we don't really recommend nasal forms or inhaling ozone kasi nga it becomes an irritant. It might destroy your sense of smell, no? So, what are the benefits of doing this therapy, no? So, the benefits are, number one, it can actually oxygenate the blood, no? So, because the ozone breaks out, it becomes oxygen and an extra free radical of oxygen. Kasi tatlo, so yung 2 becomes the oxygen and then 1 extra radical, free radical oxygen. So, the free radical oxygen, yun yung pwedeng magpatay your viruses, your bacteria, no? Or sometimes even fungus if it's present in the blood, no? So, they also found out that these ozone therapies can improve or wake up your white blood cells. Kasi once you have dead bacteria, viruses in the blood, your white blood cells becomes active. Then, something is not part of the body, sabi nila, and then your white blood cells becomes aware na, meron pala tayong foreign body or foreign invaders, so they become activated. So, ozone is what we call also an immune modulator. So, it helps boost your immune system, no? So, and I think the most, so I wouldn't say extreme, pero I think could you say most effective? Maybe it is, but there's what we call ibu, no? Ibu is like, they get blood, okay? So, meron kang two lines. One line, getting the blood out. Okay, it runs through dialysis. So, it's like a dialysis kasi the blood runs through a dialysis filter. Okay, and then before it's returned back to you, it is ozonated. So, the blood is dialyzed. Okay, and then after dialysis, it is ozonated and then returned back to you. So, that's what we call the IBU or extracorporeal blood oxygenation and ozonation. So, IBU. So, this is a more intense, no? Kasi you have 2 lines. Dapat din malaki ang ugat mo for the blood to flow out, no? But again, it's not for everyone. There are many clinics now offering IBU. So, what are the benefits aside from cleaning the blood? Again, it helps boost your immune system. It helps cleanse your blood, especially yung IBU kasi meron dialysis. But of course, that is not for everyone, no? So, what are the dangers naman of ozone? Actually, dangers are almost nil, no? The only issue really with ozone is yung pain ng injection, no? Of course, if you're anemic, you have low platelets, you cannot do that. Kasi most of the time, when we do ozone therapy, you'll need some form of anticoagulant. Kasi when you're drawing blood out, natural, pwede siyang tumigas sa line mo. So, they have to put in a bit of anticoagulant so that the blood won't clot so when it's being returned back to you, no? So basically, that's what we do with ozone therapy. So benefits, I think, would really outweigh the harm, no? So the problem is not a lot of people or a lot of doctors are aware of this therapy. But this is therapy really works. I've seen it many times already. You can also do ozone. Let's say meron kang non-heal, sugat na ayaw gumaling, lalo na yung mga diabetes, no? They can do ozone bagging. So they put a bag over the legs or arms na won't heal properly. Then you ozonate. Bubughan mo ng gas yung plastic bag, so that helps in healing, makes the wound heal faster, no? Thank you for listening to your Holistic Health Podcast. This is Dr. Homer Lim. Now, if you do have questions about your health or you would like to request topics for our next podcast, please do message us at our FB page or Instagram at Akesis Holistic Health, or you may visit our website at www.akesisholistic.com. Thank you again, and please do come back for our next episodes.